Hey, hello and welcome to the May 6th, 2026 COC board meeting. Today we are going to get started with roll call.
Dr. Sam is excused from today's meeting. Tamara Bauman. Here. Jaja Floyd.
Here.
Amaya Lenore.
Here.
Elizabeth Moken.
Here.
Dorsal Plants.
Here.
Ruby Tuesday Romero.
Present.
Devin Connick-Cease.
Present.
Kristina Sawyckyj.
Here.
Victor Liu.
Here.
Amy Thomas. Amy Thomas. Valerie Sasson.
I'm here.
Rocco DeVito.
Here.
Jen Carl.
Here.
John Urquhart.
Here.
You have 13 members present. You have met quorum.
Great. And real quick, we're just going to do the approval of the February meeting minutes. So motion would be in order.
I motion to approve the February meeting minutes. This is Jaja.
It says February, but is it?
Is it, wait,
It's actually April.
April.
I apologize. That's my fault. My fault. I meant to say
Okay.
April there.
okay, this is Jaja. I motion to approve the April meeting minutes.
I'll second
Is there a
that.
second? Okay, great. I think I heard Devin, second that. So real quick, could do a roll call vote.
Tamara Bauman.
Yay.
Jaja Floyd.
Approve.
Amaya Lenore.
Approve.
Elizabeth Moken.
Approve.
Dorsal Plants.
Yay.
Ruby Tuesday Romero.
Yay.
Devin Connick-Cease.
Yay.
Kristina Sawyckyj.
Yay.
Victor Liu.
Approve.
Valerie Sasson.
Approve.
Rocco DeVito.
I think he said he might have to step away for a second,
Yeah,
so we can
Okay.
come back to him.
Jen Carl.
Approve.
John Urquhart.
Approve.
You have 12 approvals.
All right.
Minutes
Just,
are-
just so everyone knows, we got one more thing of business that we got to do, which is going to switch an item on the agenda. It's for timing wise, and then we can do the land acknowledgement in theory of change. So the agenda items that will be being switched are the 305 updated notice of funding opportunity, project process and reallocation strategies is going to be switched with the 315 update of the rapid rehousing standards from Jeff Sims. And we're just gonna have Jeff move up to the 305 slot and move Kelsey to 315. So a motion would be in order to make that adjustment to the agenda.
I motion that we amend the agenda for the update of the rapid rehousing standard to move to slot 3:05 PM and the updated notice of funding opportunities to move to the 3:15 PM.
I'll second that.
All right, so
This is Elizabeth.
thank you. So we've got a motion by Jaja and a second by Elizabeth. And I think we could do probably a voice vote. And we should have done that on the
We
previous
can
one.
do it.
Okay, so I'll give everyone a second to come off mute, but all those in favor, please say aye.
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 Are there any opposed? Not hearing any abstentions? Not hearing anyone, I think the motion is approved. Great, so we'll go ahead and make that switch and move into the land acknowledgement, which I believe is going to be read by Elizabeth Mohan.
The King County Continuum of Care Board acknowledges that we work on the unceded traditional lands of the Coast Salish peoples, especially the first peoples of Seattle, the Duwamish people. The original stewards of the land, past and present. We honor with gratitude the land itself and the Duwamish tribe. This acknowledgement only becomes meaningful when combined with accountable relationships and informed action, and is the first step in honoring the land that we today sit on and their people.
Thank you, Elizabeth. And I'm going to hand it over to Mr. Urquhart to do the theory of change.
If we create a homelessness response system that centers people with lived experience of homelessness, then we will be able to respond to needs and eliminate inequities in order to end homelessness for all.
Great. So we are going to be moving into public comment in just a minute. I believe we have to go into public comment exactly at 2:10. Is that correct, Dorsal?
I think as long as we keep public comment open until the end of public comment, we would be fine.
Okay, great. So then I guess, did you want to take that over and open public comment? Is what I meant to say.
Happy Wednesday, everyone. For the record, my name is Dorsal Plants. I use he, his pronouns. Happy to be here today. Long roll call vote's a good thing because it means there's a lot of us here, which is always a good thing when you're doing hard work together. So we'll take the time now to open public comment. First, Catherine, did we receive any public comment in writing?
No, we did not.
We'll go ahead, and is there anyone in person who would like to indicate that they are interested in giving public comment?
I don't see anyone present in the room.
Okay. If you are online attending and you would like to give public comment, could you please raise your hand virtually and indicate you would like to give public comment? Seeing no one, I'll just do one last call. Is there anyone in the public attendees, either in person or virtually, who would like to do public comment? All right, I'm not seeing anyone. I would note that throughout the COC board meeting today, we will have the Q&A function open and available. So if you're attending and would like to raise questions, you're welcome to use that feature in the Zoom room. I'll hand it back to you, co-chair, and we'll just, I would say if anyone comes in the next few minutes running late that would like to do public comment, we'll try to fit them in.
Yeah, we'll make sure that we make some time to, anybody that's present for public comment can just raise their hand and then that'll indicate that they wanted to do that at the next convenient moment. So I guess the next item on the agenda would be handing it over to Dr. Kelly Kinnison, which is going to give us the audit update for KCRHA.
Thank you, Chair. Hi, everyone. Kelly Kinnison, CEO of KCRHA. Thank you for allowing me to join you today to give you an update on our forensic evaluation report and response and where we are with that. Just to back up, as many of you know, Clark Newber, which is an accounting firm, recently completed a forensic evaluation of KCRHA finances. Sometimes you'll hear this called an audit, but technically those are a different beast. This is an evaluation. It's actually much more in-depth over a longer period of time. And shortly after joining the agency, it became clear to me that we had a lot of outstanding financial startup issues, financial systems and conditions that needed improvement. I will say that KCRHA has always been in continuous improvement mode. I don't think anyone's ever sat back and thought, yeah, we're here, we're good. So throughout this audit, I just want to acknowledge the work of the staff and our partners at the city and county for continually making KCRHA more responsive to public needs. But there are still things to do, and there are some things that did not go well in our early formation. So this audit is really helping me kind of get underneath the hood, so to speak, bring transparency to that, which I think is something we should celebrate and applaud and not punish. And then we're going to do a corrective action plan to address all of the evaluation findings. As you know, we're audited every year by the state. We're audited frequently by federal and local partners. So our team is no stranger to audits, and the difference this time is just really getting into making sure all of our infrastructure is really sound, compliant, helps us get through audits better, and reflects where we are today as an agency that's a little bit more mature than the agency that was functioning in 2021 and 2022. So a couple of just key things that I want you to take away. One is there was no evidence of fraud or misuse of funds. The news coverage has used some words like that, words like missing money. They want your clicks, but that is not what was found in the audit. Clark Newber did a really great presentation for our board the 23rd, and I would encourage you to view that or skim the executive summary of the audit, which is posted on our website. What really is the crux of the issue, which is a very serious issue that we need to address, is that how financial information was tracked and reconciled and reported was very messy, especially in the early days. The good news is none of us has a checkbook. When we pay out funds, that happens either through payroll, which is very well documented, or through the King County Treasury. And they review a request to pay a vendor, and then they have the actual authorization to transfer money outside of the government to a vendor, so a service provider. So we know exactly what was paid. We know exactly where all the money went and to who. The problem that we have to fix and have been working really hard on is that sometimes that doesn't reconcile back to what we were able to kind of mark off on our ledger as paid. And so the mismatch there is what we're working really hard on to see if we can reconstruct from those old records, how that, you'll see the number, the $8 million. We know that was paid for services. We don't know how we can reconcile back that to our records from those early days because they were just very bad. There are a number of reasons for that, which I won't get into. They're much better now. We have no issues like that remaining with Salesforce in place, with work with our county partners to do one-to-one reconciliation, which was not the case until recently. So for example, again, this is sort of my lay explanation of this, but we all, we have a checking account, you write a check, you see the check get cashed, you make sure, right? Same amount, nothing weird. We write a bunch, we ask King County to write a bunch of checks and they say, yep, we paid $1 million out for you. And we said, ooh, well, we asked you to pay $1,200,000. So then we have to go back and figure out which of the 200,000 they didn't pay. There's no, like, we didn't pay the $200,000 to X vendor, right? So as you can imagine, has been very difficult. That's what happens when you stand up this agency outside of a King County or a city of Seattle, where internally that's all very seamless for them because they're all using the same computer systems, not the same one, but the same one within the county and the same one within the city. So when they stood up KCRHA, they didn't really understand. Now we're communicating, our system, which we're just figuring out, is trying to communicate to the city and the county, and been through a lot of growing pains. There are some other issues. Again, there are some serious things we have to do better with public dollars. But I think the The coverage has been really inflammatory for our team, for you, for service providers, for people in the community, because again, it's really misrepresenting what the audit found. Next steps. So on May 8th, which is on Friday, we have an initial response to just those really high priority, high risk items that we needed to do better on. Many of these, excuse me, are already done or were in progress. And these are mostly related to things that are sort of cash-like. So employee reimbursements, gift card use, which is mostly for our point in time count, and our P card policy. So there were 9 P cards in the agency, and we need to do a better job of making sure everyone's actually getting their approvals up front and doing the process correctly. But again, there's no evidence that anything happened incorrect. We weren't following our processes, which is a problem. But not following a process and then having the not following the process lead to fraud or misuse are 2 different things. Yeah.
So can you just tell us what a P card
I'm
is?
sorry.
That's okay.
Yes, it's a purchase card.
Okay, thank you.
So it's basically using a KCRHA credit card or something. For example, you know, if someone went to a conference for like a HUD event, and we would maybe buy their airfare on that purchase card so
okay.
that they're not putting it on their personal credit card.
Got you.
It's a more, it's the recommended way to do that for business travel and
debit
things
or
like
credit
that.
card.
Yeah, and we put some of our small vendor accounts on a purchase card, which one can debate the pros and cons of that. But again, no evidence that those were misused, but definitely evidence that we were not following a good updated protocol. And so that is already in place. The May 23rd response is the one where we're going to give our full kind of response to all of the findings in the audit and do a full corrective action plan to address everything that was found in the evaluation that wasn't already addressed in the May 8th. And these are, you know, more complex findings, right? So how are we going to work out some of these cash flow, timing, invoicing, issues with our funding partners, and we're in a lot of contact with them right now, you know, trying to work out, you know, options and path forward for those things. So those are the 2 big pieces that we are actively engaged in right now. I know there's a lot happening at both King County Council and City Council. I think, you know, my takeaway is there are real concerns, right, about how KCRHA functioned and its reputation and all of that, you know, our public officials are needing to respond to. But I think there's also an acknowledgement of all of the work that you all have done, that KCRHA has done over the years to make the system stronger. And whatever is next for this work will continue. And we don't want to lose progress and key components of that work that have been developed that are really strong. And maybe there's some areas we need to rethink. So that's my take on sort of where all of that is. Take it with a grain of salt. It's changing frequently. Now you know what I know about all of this in terms of, you know, I'm not holding any insider information back about the future of KCRHA. We're just staying really focused on making it better, keeping our eyes on the mission. We have a big thing coming up with our COC, notice of funding announcement, keeping our eye on that prize, and just committing to make this the best agency that we can within the constraints that we have. Chair, I know there were some questions. I don't know if folks would like to ask those or if I should.
I think if the folks want to ask the questions, unless you wanted to just respond to them.
There
Catherine?
were questions that I sent to you.
Yeah, okay,
To
so-
board members.
Chair Plants, I know you had a couple of questions. Do you mind if I address those? Or would you like to ask your version of those today? Or do you want me to read what I got?
I'm trying to recall the exact.
one was about the federal funds included in the audit or not, which I'm happy to address. So the report doesn't highlight any direct issues with COC funds. It also wasn't part of like transaction sampling, but obviously we use our entire system to do all of our funding, and so there are kind of control documentation, cost allocation improvements that actually we're pretty far underway of doing that we need to do to make sure our compliance is, you know, very low risk for compliance risk. We work really closely with our local HUD representatives to ensure that we stay in compliance with federal standards. We'll continue to work with them closely, and also with our subrecipients to make sure they're maintaining all the documentation and they are in compliance, which we are responsible for ensuring. So the recommendations that I would say are most relevant to the HUD funding specifically is the Uniform Guidance Readiness Assessment, negotiation of an indirect cost rate or an analysis of our indirect cost rate, some of our allocation methodologies for what funding is going to fund what activity within KCRHA, and training on grants. So we will be addressing those recommendations in kind of their own stream in that May 23rd corrective action plan. So they're called out really specifically for this board and membership, and we can make sure that we're, you know, progressing with those so that we are not increasing any risk of our COC funding not being available. Jeff, would you add anything to that to put you on the spot?
I think that covers it.
Okay, thank you. So the other question I got attributed to you was that the presentation focused on my lack of attendance at the bi-weekly meetings and that there was limited participation. Sorry, I used the word here, but that the audit took longer and cost more, and is that attributed to that? Is that right?
This is Kristina. Before you go on, I don't have a way of raising my hand, but I have a follow-up question with that. Dr. Kinnison, why wouldn't the federal program be in with like why wasn't the federal program included 100% in the audit? Is there a direct reason as to why it didn't get the same, I'm going to use the word attention, as the other pieces?
So we weren't involved in actually getting to define the scope, which caused a couple of issues, I would say. Also, I think our HUD funds are audited kind of separately on a separate schedule. Someone correct me if I'm making that up. Yeah. So really the accounting firm who did the evaluation was hired by the city and the county, and so focused on city and county funding. That's my best understanding, Kristina.
Perfect. That's what I needed to know. Thank you.
Okay, so why wasn't I at the meetings? I was at the meetings while they were executive level briefings. Then they sort of quickly became like, where's the extract from this day and that day? And you all do not want to pay me to sit in those meetings, I promise you. So I designated that to two other executive leadership team members, our Associate Deputy for Strategy, William Towie, who has a ton of finance experience, and of course, our Chief Business Officer, Tiffany Brooks, who attended all of those meetings, have copious notes, which we're happy to share, showing the level of information that was discussed at those meetings. I'm not sure why this was an issue for Clark Newber, but I won't speculate. The delays, based on an email I received from Clark Newber, were due to a couple things. One, they did not factor in needing to execute a data sharing agreement with KCRHA. That took a couple of months, like maybe 8 weeks. Those of you who have done anything related to data sharing know that those are not quick. That was led by our general counsel at the time and was necessary to give the kind of access that they wanted to basically all of our systems. And so, again, that wasn't in the scope, because we weren't involved in defining the scope, and so it added time and cost. Secondly, apparently King County submitted a public records request for some of the records, thinking that that would speed things up. And it turned out to slow things way down. I wasn't involved in detail, but that's one of the reasons outlined in the letter from Clark Newber that I received. And third, and you know, our records were not what they expected. Again, if they'd asked me what they should expect when they come to audit KCRHA 2021, 2022, 2023, I could have been much clearer about what they ought to expect, which is not what you get when you walk into audit Human Services Department or, you know, Department of Community and Housing. It was startup and it was rough, and it shouldn't have been, and it won't be in the future, but it was. And so the amount of time they had to spend to go back to Flux, anyone remember Flux? Journal entries, out of system changes, spreadsheets. Like, that's a lot of extra time if you come in and download stuff out of NetSuite. You know, were we perfectly responsive? Probably not, but the team took this very seriously. I oversaw their responsiveness and was pleased with it, especially after we kind of got that data sharing agreement going and got going. Again, access to systems was not what they sort of wanted. And so that takes time to help them understand, like, Flux is not online anymore. So, right, we can't let you drive there. So that is, again, my understanding of the delay. Chair plans. Okay, then member Lou, who is going to be on the finance committee for the governing board of KCRHA? That is Executive Sawyckyj, Mayor Wilson, Councilmember Foster from Seattle Council, Councilmember Barone from King County Council, Councilmember Jang from Issaquah Council representing Sound Cities Association, and board member Aviva, who is our expert with lived experience. Also the executive director of Mockingbird now. And she's appointed by King County.
Great.
I believe, say those one more time. please?
Sure. I'll just do last names.
Okay, yes,
Sawyckyj,
that's what I need.
Sawyckyj, Wilson, Foster, Barone, Jang, Aviva. Yes.
Thank you.
Thank you so much for giving that details. I think it's been a really interesting, you know, to watch this kind of all unfold from understanding what's been going on and just understanding, you know, I mean, it's kind of hard to have really efficient process, like have a past, you know, thing get fixed, right? So it's like, it's hard to go back in time. And so you're doing the best with what you can, and we really appreciate that. So thank you. Yeah. Did we have any other? Yeah.
Calendar questions? Dr. Kinnison? I have two, actually. First of all, you mentioned that the agency is audited every year, basically, either by the state or by somebody. Did any of those audits bring up anything that Clark Newber found? Any issues?
There's some issues related in there. The biggest material findings, so like the big thing that is going to keep showing up in every audit that's sort of recent and ongoing, is our funding model. So this relates to this idea that we were founded, they said, pay providers, and then your funders will reimburse you for those payments. That creates a negative balance. And through the years, we got some cash advances to sort of help with that. But those became less frequent, and you know, there were some delays with those for various reasons over the years. And it seemed like by like 2023, that was sort of getting more irregular. And so we started running negative a lot. And then once you do that, the interest starts accruing on our account in the King County investment pool. It's not a bank account. So that's a structural problem. And we can take steps to mitigate that. We can shorten the time between paying a provider and getting repaid, which we've done a lot of. We can make our invoices better so that they're not coming back and forth between us and our funder a lot, or between the provider and us a lot. We also do a lot of just maximizing every dollar going to services, which when you're braiding a lot of funding means you might need to switch which funding source you're using to pay for something, because that one's gonna expire sooner, right? So you have food in your fridge, something's gonna expire, you wanna eat that first, right? Same with this money, you don't wanna leave that money on the table. That switching around, as you can imagine from what I've already explained, was very, very challenging. It's so much better now, thanks to our finance team, our partners at King County, our new system. Sorry, I totally lost my train of thought. Thinking about the funding swaps gives me a heartache. The interest rate that accrues because that back and forth is happening is sort of like one of those structural things. So we can help do those funding swaps better. So there are things we can do to narrow that gap, but a cost reimbursement model is always going to have that risk of running into the negative. The auditor said they do know of places that are using it successfully, and I asked for specific examples because I suspect those folks have either some sort of endowment or fund that they're sort of borrowing from. But we don't have that. So that is a finding from a recent audit that we'll see until we address it.
Secondly, you mentioned that you'll ask King County Treasurer to pay $1.2 million and they only pay $1 million. Do they tell you ever what happened to that $200,000 and why it wasn't paid?
Now, yes. Several years ago, it seems like sometimes you might get a phone call, might get an email, might have to we had someone whose whole job was to sit down and reconcile that.
Wow.
Yeah, that would seem to be an issue.
Can you imagine that?
Right.
For a layperson.
Yeah, like I'm terrible at bouncing my checkbook anyway, like having to piece it back together.
And having to have it as
Yeah.
a job.
Yeah, again, people are doing the best they could,
Right,
right? Like
right,
this
yeah.
it was tough timing. And you know, this is not any one person or really one agency's issue. This is a growing pains. And you know, reasonable people can decide that some of this stuff should have been fixed sooner. And, you know, I know with the operating context, how hard that is, but maybe you would make different choices than I've made or that others made, and that's fair.
Really quick, I did see Valerie's hand and then we can go to Joshua. And I just want to make sure that we're on time today because we do have limited, so just throwing that out there. Valerie, go ahead.
Thank you. I do want to thank Kelly for being here with us today. I really greatly appreciate it. There is concern, I'm sure, inside the organization that this cost reimbursement model, this funding model flaw, this structural problem, because it is the base of the organization, that it's potentially a fatal flaw. And I'm just curious if you feel like the adjustments that you can make are going to compensate for that, or if at this time you feel that there's an alternative structure possible for the agency.
Yeah,
I'm trying to be a Debbie Downer. Sorry.
No, I mean, we have to be realistic, right? There are business decisions to make here. I think we can make some changes. I think all those options are on the table. I think what I am very much advocating for is take all the best things and build on those and figure out what needs to be fixed and what the options for fixing those things are. And think about the trade-offs, and there'll be costs to those fixes as well. So yeah, I mean, one could imagine a different funding model. All of our providers work on this model, I should say. Right, many of them have the ability to do outside fundraising to sort of bridge those gaps. You know, it's still tough for them, but we explicitly do not have that authority. So there are a few options our teams have worked on with the city and county, and I think those will definitely be highlighted in our response on the 23rd.
So my question is, first of all, I want to thank you for coming and thank you for standing up for the KCRHA. I know media wants to dismantle, or just one person can cause a slew of craziness. And I just want to thank you for standing up. And I want to ask about, you know, the KCRHA is nonprofit, right?
We're a public agency.
You're a public agency, but so the money thing, you said that you pay now, get reimbursed later. Is that still the model? It is. Was that always the model from the start?
Yes.
So maybe that's why the money's all crazy.
I think that's a good observation.
I mean,
So,
I was just wondering.
I think I see Dorsal's hand, and then I just wanted to remind that we do still have public comment open. If there's any, I see some guests have shown up since we last spoke about public comment, so I just wanted to offer that opportunity to still go ahead and raise your hand if you did, and we will come back to you at about 2:48 to make sure we have enough time for everything. Dorsal.
Thank you. So I guess I'm trying to understand, because I have limited professional experience with a reimbursement model. And I think something you said maybe understand like the challenge, but I want to make sure I understand what you're saying. So like, as I understand a reimbursement model, you have a pocket of money. I have $1 million, and somebody's going to give me a receipt that shows that they spent $10,000 that I can then give them $1 million from. And I guess what I'm hearing you say is that because you all aren't necessarily the ones holding the money, that the process was taking so long or had so many challenges that it was creating delays that allowed for the interest to accrue on the pending reimbursements.
Correct. And some, and some other related issues that we're still sorting out. So one of the big ones in the audit is we implemented a new grants management system called Salesforce. It has helped solve a lot of these problems, and we started the implementation in 2023. So again, take this as my reconstruction. The agreement was sort of to proceed out of existing funds and kind of do it as possible as existing funds were available. And if any of you have ever done a big tech rollouts, like once that train is on the tracks and going, it's and especially when it's going to solve a problem that I think the board was asking folks to solve, which is you have to invoice quicker, more accurately, you have to pay providers on time, right? Some of that was still getting sorted out. And so the decision was made, KCRHA and funders, to sort of move ahead with that without really budgeting for it. And that ran over budget, significantly over budget. And and so that's like just administrative overspend that we need to get permission, to have reimbursed in retrospect. And that's not how you want to do things, right? When you're budgeting. So there's some things like that, as well as sort of this cost reimbursement lag, and potentially those, the reconciliation issues that we talked about, that created, like, if we can't reconcile it, then we're not billing for it, and therefore we're paying interest on it instead of getting paid for it.
I think this will be the final question, if that's all right with everyone. Valerie?
Yeah, just quickly, I feel like this is a structural phenomenon on an agency level. That's the same phenomenon that our systems use to keep people impoverished, which is essentially relying on payday loans. And I know you all agree, it's infuriating and it is classist, and I feel mad. So I really appreciate you, Kelly, for taking this on. And it is a bigger fight than what you're fighting, but we appreciate you fighting this good fight. So
Yeah.
Thank you so much. You all are closer to this than a lot of folks are, and so I appreciate getting to talk this through with you. Ways you can help KCRHA if you're so inclined, I think, is sort of carrying that message of, let's slow down, let's be thoughtful, let's be strategic. Yes, we may need to make changes, but let's do that thoughtfully. Let's do that with, community-driven needs in mind, 2026 in mind, not 2021 or 22 or 23. And when you hear those sort of weird, dispelling some of the things about the missing money, or the one that comes up for me a lot is like, someone sends us some check for $200 million and then we get to decide how it's spent. You all have been around long enough to know it's absolutely not how it works. So we do a lot of paperwork to get those contracts that the city and county tell us to renew. Then that allows vendors to bill us. Then we pay them out of an account that has $0 in it. And then we ask the city and county to put that money back in our accounts. And so this idea that sort of we have a bank account somewhere with like $200 million in it is like absolutely not a thing. So I know you've all done this work for a really long time, longer than I have, and I've heard all of these misunderstandings. But I think right now it's just really playing on all of those. So
Yeah. Oh, no, you're great. No, thank you so much. This has been really, like I said, it's a very interesting situation, and we really do appreciate it. Like, I couldn't have said it better than Assess doing this. So it's been an interesting time, and thank you so much for sharing all this with us. And I mean, I feel more comfortable knowing a little bit more, and I'm sure the board does as well. I see some head nods there. So, yeah, well, you're off the hook for now.
okay. Actually, I'm super interested in the next few items.
Oh, yeah.
So I might stay as long as I can.
Yeah, please feel free. Yeah, so I think I'm gonna hand it back over to Dorsal to do the final. Oh, I see a hand up in the attendees section, so we do probably have time for this, the public comment, and then we'll close it and move on at 2:50. That's okay. Do you want to handle the public comment still, Dorsal?
Sure. If you would be so kind as to unmute, I believe it was JJ, you have 2 minutes if you'd like to address the board. Feel free to go ahead.
Just 1 second. I forgot where I am.
Yeah. If you're speaking, JJ, we can't hear you. I can now.
Can you hear me now?
Yes.
Yeah.
Excellent. I don't need 2 minutes. I just need 3 words in this. Timeliness is lagging, I believe. Secondly, is this that I find that there is a lack of urgency. I heard that in several of your comments about that word. And thirdly, is this that competency is a concern. It has been a concern. If I'm doing something, I don't have those skills, I just couldn't execute the action. That's all the comment I have. Thank you.
Thank you, sir. All right. I'm handing it back to you, Ruby, to introduce the next section. Yes.
Yeah, did we just want to close public comments though?
Yeah.
Oh, wait, well, I guess,
Oh, Kristina, did you have a question that we missed?
Yes, I did.
Oh, sorry
I-
about that.
No, I try not to, this is Christina, I try not to be rude. Dr. Kinnison, I just, with one of the pieces on the on whatever her name report is around the gift cards, just note that like Jaja and I are part of the healthcare for the homeless, and we've been doing the gift cards in accordance to all the county, state, and federal rules for years and years now, to look at what is already being done with other King County offices. That there is ways of doing it that's out there, and just be mindful that other groups have already conquered those dragons, to just take them on and kind of follow what we're doing elsewhere. That's all I wanted to say.
Thank you for that information there. Definitely look into those. Great, so the next thing is gonna be the vote on the Continuum of Care Board meeting procedures. And I think I'm gonna hand it to Dorsal to speak more about this a little bit, but just to give you a refresher. This was something we discussed during the retreat with the parliamentarian about having meeting procedures and what those and how those function. So Dorsal, did you want to say some words on the item today?
Sure. Again, dorsal plants for the record. Basically, at our retreat, we had an opportunity to learn from, I think, one of probably the best organizations in our region, at least in the subject matter that they have expertise in. And so this is an effort to just create a codification of that conversation. This is not something that's set in stone. That's one of the advantages of this approach. This is basically us as a board sitting down and saying, we want a document that we can hand to the public, or we can hand to a new board member that says, hey, here's your first meeting. Here's how you can bring an issue up. Here's how to make a motion. Here's what we're expecting of you. Here's what you should expect from our wonderful support staff here. Here's what you should expect from your co-chairs. By doing it kind of here at the board level, it gives us an opportunity to amend or make changes as we need to as a board. It's something that we should think of as a living document, because as things change, as technology changes, as procedures change, it's something that we'll potentially come back to regularly and visit. But really what this is just a starting point. Think of it as a light jacket, like something that we can put on. We can try it on for a little bit, because we've got new board members coming on here in another couple of months. So it's just something we'll try on, and then in a couple of months we'll revisit it, and that jacket doesn't fit, throw it away or thrift it. We'll get a new jacket, or maybe the jacket's right. But the main thing is, this is not an end point, it's a starting point. Happy to answer questions, but yeah.
Yeah, did everybody get a chance to read the document? Everybody has seen it. Can we maybe pull it up? Or no? Okay. Sounds like everybody did. Cool. Then I guess this motion would be in order to approve this living document of the meeting procedures for the Continuum of Care Board. Motion would be in order.
I'm John Urquhart. I move that we approve the board meeting rules and practices.
This is Christina, is second. Or Jaja, one of us, yeah.
So I heard the motion made by Mr. Urquhart, then I heard a second by Kristina and a third by Jaja. And again, this is a living document. Is there any discussion or questions on this before moving into a vote?
I missed it.
You missed it? Well, we're discussing the meeting procedures for the Continuum of Care Board. It was sent with the meeting materials, and we can revisit it at any time. So it's a living document. Okay, we'll go ahead and do a roll call vote of that. And Catherine?
I'm ready. Tamara Bauman,
No.
Jaja Floyd,
Yes.
Amaya Lenore, Elizabeth Moken,
Abstain.
Dorsal Plants,
Approve.
Ruby Tuesday Romero,
Approve.
Devin Conixes,
Approve.
Kristina Sawyckyj,
Approve.
Victor Liu,
Approve.
Amy Thomas.
So,
No, we do have Amy, she's on the phone.
oh, I apologize.
Valerie Sasson,
Approve.
Rocco DeVito,
Approve.
Jen Carl,
Approve.
John Urquhart,
Yes.
Let me go back and call her.
Amy,
Amy,
she wasn't able to talk at the time.
Amy Thomas. Amy Thomas.
yes.
Amy Thomas, can you hear me?
Yes, we can hear you.
Okay, I approve. Sorry, I didn't know I had to press *6. I apologize for the delay.
You're good. Thank you so much.
Amy. And did Amaya come back? We have 11 yeses. Motion has passed.
And just like I said before, we can always go back and revisit them and make sure that they fit our board.
Living document.
Yeah, living document. Okay, so the next order of business is the break. Do we want to take that now? Or would we like to move into the rapid? I think I see some head nods on the yes there. So that way we can still get started with the rapid rehousing standards a little earlier, but.
And the captioner could take a break.
Yeah, okay, great. So we'll be back at 2:57. Thank you.
I think we said 257. Okay. Got one.
Sorry, Kelsey.
It's good that you're here, Victor. I need you here. It wouldn't be a COC board meeting without Victor. All right, everyone. Welcome back. We are moving ahead, and we modified our agenda. So I believe we will be hearing from the amazing Jeff Sims about the rapid rehousing standards work that's been going on.
Pressure there. For the record, Jeff Sims, I use he, him pronouns. I'm the Chief Program Officer. This is an update on the last time I was actually in front of this board was last, I believe, November, talking about the same thing. There was an intentional pause shortly after the last presentation we had with this board because of the release of the COC NOFO, the tremendous impact it would have on other rapid rehousing agencies already, and desire to say we can't do that many things at once. So we had an intentional pause there. And I wanted to make sure we brought this back to the board. We have multiple new members. Also, it's been now 6 months almost, or approximately, since we've talked about that. We are still continuing to do work on them, as you'll see. So we'll run through some of those items. And I want to make sure that we're kind of refreshed here because we do anticipate continuing to wrap those up. There's been a lot of work to develop the guidelines. Now the implementation of them and rolling them out, that might change given larger context like what Dr. Kinnison presented on, but it's important to know that we still are working on these various items and that they have some important impacts. So we'll go to the next slide here, which is just kind of the overall timelines that we've been working on. You can see that some of this started a long time ago. We've had multiple rounds where things have paused and then recontinued. But it did start off with various listening sessions. There's been a very intentional aggregation of funding source requirements to make sure everything is captured and thoroughly reviewed. We've had multiple rounds of review at this point from we can go to the next slide too. It got separated here from HUD-TA, from the county and the city doing reviews and showing it again. So multiple meetings at the cross-cutting policy work group of this board and many meetings specifically around diving into like the rent subsidy model, but also other guidelines and operational needs of our rapid rehousing agencies. So it's been a very robust development of these guidelines as we work to move towards them. I'll go to the next slide now. Again, this largely arises with 4 key things that we were seeking to accomplish with these. They're largely technical changes to improve operations. And the first one is make sure that we are incorporating person-centered and trauma-informed practices. And some of that needed to be more thoroughly restated as in a comprehensive way, even though it was already required by fund sources, things like that. There was also feedback on forced deadlines on households that was not allowing for the most effective engagement with households or the most effective movement towards permanent housing outcomes, things like that. So that was another goal here. And then also making sure we have a more standardized experience of what a rapid rehousing program is going to provide across our various agencies because there was differences in how that would proceed and trying to make sure that there is more consistency to the degree that you have the ability to depart from like some agencies would maybe like try to seek to have you moved in and off subsidy within a month, whereas others might have a much longer duration that they would target trying to get you towards and balancing that out a little bit. We've had multiple sessions. This I won't actually read through this side just because I know we're a little bit short on time, and also I'm going to have to go to a separate COC meeting here that's with other stakeholders. But these are various pieces that some of our most recent feedback was from providers and what we should be seeking to accomplish with some of these revisions. The one I would highlight, for example, is the ramp down period. As we were working through what is feasible within the existing pathways that we have, we had departed a little bit from the type of ramp down that people were hoping to see, and they're saying, no, we need to have a more thorough, consistent, standardized approach to that. So those are some of the types of things there. The other thing I would highlight at the end, which has been, it's going to be the next slide that I talked to you about, was wanting to combine a rent-based and an income-based approach to calculating the type of assistance that would be provided to a household. We had done those separately, and the feedback and engagement we had gotten was pretty universally split. In fact, one of the polls was exactly 50-50. So as we were working with asking providers to provide feedback on them. So we have actually done that. So now I can go to the next slide and talk about, although we weren't wanting to push our external partners to do things that would be unfeasible while also going through a COC NOFO process, we were seeking to make sure we continued to more thoroughly develop that. That pause and work allowed us to add some additional data to some of our modeling and analysis of how we were doing things. And you can see some of the revisions that we were able to incorporate into how we were projecting out how rental subsidy models impact a household, things like that. This has been, how many requests have I given? 4, something like that. They haven't always been to you, but R&D has gotten something that, not a real question. You started to write down, I'm gonna get back to you. There's something around 4 to 6 data requests that our team has then gone through. Our research and data team at KCRHA has gone through and analyzed what is the household composition across all of our households, types of lengths of time that they are receiving support for, number of households receiving rental assistance versus just enrolled, lots of different pieces that you can see listed on the screen. So our next steps as we try to bring all of that together, one would be having HUD technical assistance review that. That's already been done. We shared those for another round of review to make sure that we've really thoroughly captured all of the requirements that are really stemming from fund source requirements. And then frequently we will defer to a COC standard where it's necessary because it's laid out in ways that another component might be unclear or not have specified something, and allows us to be more thorough in our approaches. There would be another round of having the county and the city providing us feedback, especially after we finalize those subsidy models that we've already given a couple rounds of that already. Then we call them base building spaces with our provider agencies. We might not actually utilize like necessarily a base building meeting, but there's a group that consistently participates. And so it's setting up a meeting, and that's how we've been engaging with our provider agencies so far. And then also, and this is a key way that we get the perspective of people that have utilized these systems, working with our cross-cutting policy work group as well, which is a subcommittee of this board. All of this would lead up to formal adoption by this board. And then there would need to be an actual launch of those standards, which well, not all of you had participated in this conversation before. The feedback we had consistently received was to achieve that by doing a reprocurement. So agencies could right size their budgets, their staffing models, their performance commitments. At this point in time, we need to see how some other things unfold before we can make clear direction on how we proceed there. So I would not, we had initially projected for something to occur in June, July, which wouldn't be a realistic timeframe at this time, and we'll be following back up as we have better idea about the direction that'll be going. And then there have been agencies that have taken the lessons that they see in the standards, the drafts that we're putting out, and proactively are implementing them on their own, because there's a broad recognition of some of these being very helpful. That's actually also been very useful for us, because we've had, you know, pilot agencies that have come back and been like, actually, conversations with these households, when we've gone it with this route instead of that route, so much better around like thinking about household financial management and budgeting. We really love this change. Don't lose it, you know, things like that. So I think these are overall technical improvements in how we'd operate these programs. And it's been really helpful to have that kind of feedback and informing that. I think that's, did I have one more? No, that was it. That was, I want to make sure that the group is not losing sight that we are doing other things throughout all of these processes. It's very diligent work with lots of engagement and lots of data informing all of that. So as we come back to you, I wanted to make sure it's fresh in your mind, especially because we know that the COC NOFO process, which I think Kelsey's next on that, right? Is basically on us. We've already, Kelsey will point out to you, already on our website, and as noted in our blog that went up just a little bit ago, we have already posted our notice for pending RFPs that are going to be released soon, and a tremendous amount of information for agencies that are interested in continuing to receive or potentially receiving COC funds that's already available. We are there. HUD has said later this month it's starting. So it's important that we had this opportunity to remind you of other things that we have going on now as our attention gets distracted by that really important process.
Right.
Any questions for Jeff? All right, well, good.
I have one, Doris, so this is Jaja. For some reason, I thought I seen something about affordable housing up there. Did I miss that? Did I see that on the screen? I
I
wanted to,
don't recall that.
I think it was the second to the last slide, but I may not have seen it.
Let me look. Hang on, my computer fell asleep while we were talking, so.
It's not there?
The second to the last slide.
No? Yeah, I think it's-
Apartment size, if you have that
No,
there.
I wrote that down, but I thought for some reason I seen affordable
So
housing.
things that we
It's okay.
incorporated into, that was this, Jaja's referring for those that aren't looking at my computer right now. Yeah, is looking at the slide that talked about the data that we added over the last few months to further evaluate directions we were going. It was household composition, apartment size.
Right.
That might be one of the pieces. We were able to get more nuanced with some of our, or more finer, more precise with our estimations, I should say.
Right,
Household income, area median rents,
yeah.
length of
I see that.
stay, rental assistance by household type,
Yeah,
and households moved in, including breaking that down by a month.
maybe I was just wishing it would be affordable housing.
There is, that, it fundamentally does coalesce around
That's what I said.
how do you support a household that is coming out of homelessness, it's a rapid rehousing program,
Right,
and moving to a place of self-sufficiency at
Right.
the time that they exit the project. And the more that we can do to make sure those are effective are really key, because ideally that is a really solid exit ramp
right.
from homelessness for households, and we do not see them returning, and we want to make sure we're doing that as frequently as possible.
And that's what I want to commend you on, that I see with these changes, that's what I see. That you're taking into account to keep people from returning to homelessness, an avenue that they can proceed down.
Mhm.
Right, yeah, so maybe that's part of my
Yeah,
affordable housing in my mind thing.
no, yeah, it's all fundamental to why we're seeking to codify and tweak some of these technical changes to make sure that we've got really strong procedures for agencies to operate and achieve that.
Thank you for that.
All right, last call for questions because I know Jeff's got to run. All right, good luck in your next meeting, Jeff. All right, we will begin transition to the next thing. Basically, as Jeff alluded to, there's been a lot of things that we've talked about on this agenda that are important. And there's been a lot of conversation in the media around our partners in KCRHA and the work that we're doing here as a board. But we can't lose sight of the fact that the NOFO this year is the primary objective that we have to achieve. We have to support the membership. And I want to say publicly, as your co-chair, I strongly, firmly believe that you all are the right people for this, and our collaborative applicant is the correct partner for this. And we're gonna work together to get through this process, and we cannot lose sight of the fact that the NOFO is our primary objective. And with that, I'm going to turn it over to a person I genuinely consider as an expert on the NOFO process, Kelsey Beckmeyer.
Thank you, Chair. I'm going to pull up my slides and we will dive in. Are you all seeing this online? Okay. I am just making sure. Okay, it is also now playing in the room. Got it.
It switched to presenter for us.
Presenter for you. Well, that is odd, but we're gonna work with it. Good afternoon, everybody. Kelsey Beckmeyer, she, her pronouns. I am the COC manager with KCRHA. Giving you some updates on where we are with the FY26 Notice of Funding Opportunity for Continuum of Care funds with HUD. want to give you first a little bit of an overview of kind of where things are at, both with fiscal year 25, which is what we are moving into in terms of spending and program periods, and what we are preparing for the FY26 competition. So as was shared last month in our meeting, the FY25 Q1 awards were announced at the end of March. The Q2 FY25 awards were announced on April 27th. Yesterday afternoon, we received the first and only grant we have in Q1, KCRHA has in Q1, to begin review and process for the grant agreement. I've confirmed with King County, who holds the other grants for Q1, that today they received their grant agreements. So things are moving in terms of receiving awards for FY25. FY25 Q3 and Q4 awards have yet to be announced. The deadline by which those need to be announced per the Promotions Act is July 1. So we'll be keeping our ear out July 1 for Q3 and 4. Closing out of fiscal year 25 conversation, moving into our fiscal year 26 conversation. 2 Fridays ago, I think it was, or maybe it was also on April 27th, might have been the same day. HUD posted on grants.gov the forecasting of the FY26 NOFO. In that forecasting, the anticipated release date is May 29th, 2026. HUD then sent a email through their SNAPS competition listserv that it would be June 1st, 2026. So we're kind of going with a May 29th to June 1st. I think we'll see the NOFO. The anticipated due date is August 26th, 2026, which I am personally pleasantly surprised that we have a decent amount of time to accomplish this. This is a time frame that we are used to seeing, gives us a good response period of time. In preparation for this, noting specific deadlines that are typically required by HUD, there are points where all of the application materials from project applicants need to be into the consolidated applicant, which is KCRHA. There are times where we need to announce the results of our local competition. And there are times that we need to be able to publicly post the draft of our entire application. So those timelines are built out and we are preparing to meet those with kind of some cushion dates around them in case there are any hiccups that we meet along the way. Additionally, we have posted both notices of funding availability and local competition notices. The NOFAs are for anything that would be a new project. The local competition notices are anything that would be existing projects that currently get funding who want to either renew their project or change their project in some way, shape, or form. Those are all posted and available on our website. A blog post has been out and an email blast and other kind of broader communications are scheduled to go out tomorrow. In that posting, we have included what is called a request for information. This is to gather greater detail on kind of system collaboration work that partners throughout our COC, whether that's within the homelessness system or outside of our system, but our close partners, health system, medical system, workforce systems, what partnerships they may have among each other, as those are things that we are asked to speak to as the collaborative applicant on behalf of what is occurring within the COC. So we are putting out a request for information so that the response that KCRHA prepares to send to HUD is as detailed and robust as possible to highlight as many active and existing partnerships that we might not know about at this moment in time, so that we can have that further information by the time we are submitting these things in August. So doing a little bit of kind of preparation work. In prior years, we've done this through setting up kind of one-on-one meetings with different system partners. So we're wanting to do this in a little more broad way. So we're casting a bit of a bigger net. We will still have those more targeted conversations when we get to the detailed work of the consolidated application, but doing a both and approach to just have as many different tools in our pockets as possible. Last month, we talked about some of the reallocation strategies that we are considering, knowing there is a very likely cap on how much of our funding that we are currently receiving may go toward permanent housing projects. In preparation for this, we have met with all of our currently contracted COC funded rapid rehousing and joint component grantees around potential impacts of a permanent housing cap. We have those meetings to lay out possible options for those programs to think about in terms of this upcoming competition. Though some of those options include potential transition projects, and through the Youth Homelessness Demonstration Project, or YHDP, what's called a replacement grant. We want to make sure folks are making informed decisions and have ample time to make those decisions within their agencies. No final options or decisions will be made until we see the NOFO actually published. But a lot of those kind of just preparation work is to have plan A, plan B, plan C, plan D. Once we see the NOFO, we will then kind of have better ideas of what plan to implement. So no final decisions will be made until there is, in black and white, what HUD is expecting of us. Want to give you all a little snapshot of what we are aiming for over the coming months, particularly as it relates to kind of the earlier decisions and earlier processes related to the NOFO. After this presentation overview, we'll dive deeper into the rating criteria. This is going to be y'all's first look and first discussion about rating criteria. May 20th at the System Performance Committee, we will be doing a more in-depth review of possibly some application-based rating criteria. That one I have an asterisk because that's really going to be based on what the NOFO says. So I don't want to put too much that is concrete in writing around application information. So there might be a little bit there, but then really the main focus will be around new project rating criteria. If you are not on the System Performance Committee, I strongly encourage attendance. We will be sharing those materials for the meeting. They'll be online. We will share them out with all of you, particularly ahead of the June 3rd meeting. We'll also review at the System Performance Committee on the 20th updates to the HMIS and other database information. What I share with you today is a little bit of updated information than what the SPC heard in April. So we'll make sure that there is continuity of information flowing between all bodies. June 3rd, this is a slight adjustment. We're kind of pivoting a little bit, but June 3rd, we'll do an update to the board around the new project rating information. And yesterday, you all should have received a communication from Catherine around scheduling a special meeting that is kind of a tiered meeting process. So in the beginning, on a June 8th special meeting, will be a deeper presentation around the hopeful final rating criteria for renewing projects, transitioning or replacing projects, and new projects. That will be presented for the SPC. They will have a time to deliberate, and then as their portion ends, the full board will have time to review and hopefully have a final vote on rating criteria. Now, why June 8th? We are anticipating that the NOFO again drops in that May 29th to June 1st time period. We want to get our applications out and live so that providers have time to apply. We want to give them at least 3 full weeks to do so. So our internal timeline is to get everything released and available by June 10th. June 3rd is too early. We don't have enough time to read what HUD is saying, make the necessary rating adjustments, balance and review everything to make sure math is mathing in about a day and a half to read usually about 120 pages and do all of that. So giving ourselves about a week to do that. We don't want to move too fast because we don't want to make mistakes that we have to then go and review, bring all you back together, present, vote. So that is why June 8th is kind of the sweet spot that we've kind of landed on. And then June 10th is when we anticipate being able to release the request for proposals for new projects, as well as the applications for renewing projects and those that may want to transition or do a YHDP replacement. There is a lot of like technical jargon and NOFO jargon. So I hope you are following. I see a hand in the room as well. So I'm gonna pause for Elizabeth.
That last acronym, YHD.
Youth Homelessness Demonstration Program. This is a COC funded special initiative for youth and adult projects. King County is a YHDP community. We were awarded in the first round in 2016. We anticipate that those projects that have just been non-competitively renewed, so we haven't had to rate them or put them in our ranking, will have to be competitively renewed, and they will be considered a part of a potential cap on permanent housing projects. So
You are thinking that, or you know that?
I am thinking that based on the December 19th, 2025 NOFO that HUD posted online. Yes. Other questions related to these updates? Yes, Doris, I see your hand.
Just a quick one, and this might be early, but since we're talking rating and ranking, I know a couple of other agencies, I believe the county and Washington State have set up contingency funding potentially in relation to COC funding. Have there been conversations about how like that potentially would be implemented, and would it be able to align with the rating and ranking criteria that we're using for the COC, like COC? Do you understand what I'm asking?
Yes, and the contingency funding that has been dedicated, you're thinking of the City of Seattle and Department of Commerce. Those are all related to calendar year 26. So would not have any impact on the FY 26 process or competition. So there's a little bit unknown at this moment in time about how those funds may be accessible.
Got it. Thank you. Other questions for Kelsey?
Amy Thomas? Amy Thomas?
Yes.
Go ahead, Amy.
So, sorry, elephant in the room ahead of time. Due to recent news articles and press, has HUD reached out to KCRHA Are there any concerns with that? For the NOFO?
We have not had any official communications with HUD in that regard. We
Okay.
are in close contact with our local field office. Yeah. And they
Thank you.
are here and we're connected and have ongoing meetings. Yeah. And Devin, I see your hand.
Thanks, Kelsey. Yeah, this is Devin Konixis. I'm just wanting to make sure I understand right now the only, I guess, request that is out is this RFI for the cross-system collaboration. There is no, local application process that started yet. Okay, thanks.
Right.
All right, last call for questions. All right, well, Kelsey, I think you are off the hook, and we'll turn it over to our next speaker, Kelsey Beckmeyer.
I was waiting for you to go there. We will seamlessly move into our next topic, which is also related to the FY26 NOFO. So I want to give you all a review around the rating criteria. So the intent for today is really just to develop some awareness and understanding with you all around the NOFO rating criteria, what it is, how we use it, and a little bit of the purpose and rationale around some of the recommendations that KCRHA is bringing to both the System Performance Committee as a subcommittee of the board and ultimately the COC board. I want to get input from you all regarding the changes that we are recommending. And nothing will be finalized until subsequent meetings. So really want to have conversation and make sure that there is just a clear understanding. The primary focus today is going to be based on HMIS, or our Homelessness Management Information System, and other data-driven rating criteria. A little bit about the why we're talking about this. Our HMIS rating criteria hasn't been significantly updated in at least 6 years. So one, we're wanting to make sure that the coding of how we are running data and running scores is really clear and understandable and logical, and making a little bit of some data cleanup pieces. So on the back end, when it's run, there's really clear data that's being reviewed to then generate a score. We also want to align our rating with stated priorities that HUD has highlighted, while also supporting local values that are held within our COC. When we're talking about kind of HUD priorities, we're really talking about what we are seeing in the December 19th, 2025 NOFO that HUD posted. This is kind of the blueprint that a lot of communities are using for planning and preparation for FY26. In that NOFO, HUD created some point allocation requirements that are different than previous years. One is around objective criteria that we use to evaluate programs and the available points of how high something can be rated. Previously, it was 30% of all of your total points had to tie back to objective criteria. The December 25 NOFO increased this to having 50% of the total available points needed to come from or account for objective criteria. The other piece that is fairly significant is that at least 25% of the total points available must account for 3 measures in particular: returns to homelessness performance measure, exits with employment income performance measure, and a supportive services participation requirement. So that means we also have to look at our point distribution and rating of various metrics and criteria to ensure that 25% of the total score comes from the available total of those 3 measures. I'm not going to show you all the spreadsheets that I've got and all the tabs that are weighing all of these things and looking and making sure we're doing all the objective pieces. Because that will be in flux. We are not really going to talk too much today about the point allocation totals right now. It's really going to be focused on the metric information, because the point allocation won't really be finalized until we see what HUD publishes, if it's still aligned with what's in front of us right now. So while I'll give a little bit of kind of where we're going and what we're thinking, that's not going to be the crux of kind of the conversation, because I don't want to finalize anything before I know what we're working with officially. So I'm going to move us into talking about the HMIS data criteria. So these are really tied to system performance measures and what we see in an annual performance report. So I'm going to talk to you around kind of the overall recommendations, input that we've received from the System Performance Committee, and a kind of, I will show the ones that have a recommended change. There are some metrics that we're just going to maintain, so we won't talk as in depth with those. Included in what you all received in preparation for today is a much longer detailing of every criteria and the point allocations. And that will continue to provide that more in-depth material than is necessarily in a PowerPoint screen. But we want to make sure that we're balancing the point allocations. That's something that's really important. So we are using that FY25 NOFO as a guide to prepare, again, what are we looking at? What are we thinking? We're wanting to update and clarify metrics just for more sophisticated coding, and then ensuring that we're valuing what we value while including measures that we know we need to include from a HUD perspective. When presenting these metrics to the System Performance Committee, the key piece of feedback we got from the System Performance Committee was for those criteria that have a higher total score to include more gradient scoring. A lot of metrics, it was either you get all the points or you get no points. So wanting to include gradient scoring, that is, for example, if you get a total of 10 points, there's an option to get 10 points, 5 points, 0 points. So having a range of scores that a metric can provide versus all or nothing. So our metric to permanent housing, this one, we're not really changing what the metric itself is. The aim is to meet our system targets, which for permanent supportive housing is that 90% of people in permanent supportive housing either remain, or if they exit to a permanent housing solution. For transitional housing, and pardon me for the acronyms on slides, trying to keep things visually succinct. But for TH or transitional housing, the system metric is that 80% of those who exit transitional housing exit to permanent housing. That is the same metric for those who are exiting from rapid rehousing are exiting to permanent housing. There will be a gradient for scoring. So those that are between the system target and the minimum. So the minimums are stated here for permanent supportive housing. The minimum is 45% of people if they exit to permanent housing. That would be, you get no points for that. But we are putting a gradient score. So if your exit rate is between, 45.1% and 89.9%, there would be a mid-range score. So we're wanting to include a gradient here. That's what you will likely see. We are including a new measure. This is a metric that we will include for permanent supportive housing and safe haven projects. A safe haven is a specific low barrier supportive housing model. We are including a metric that is 85% or more of the residents remain stably in those projects for 2 or more years. So we want to create, again, that retention point for that project. This is balanced out with another new metric. This is a metric that is included in the FY25 NOFO. Is around exit to unsubsidized housing. HUD has underlined this in a couple of different places around wanting to evaluate how COCs and how projects are connecting folks to unsubsidized housing opportunities. So the kind of metric is that at least 20% of participants who exit to unsubsidized housing.
Correct.
And this will be a measure, just one moment, Joshua. This will be a measure that's used for rapid rehousing, transitional housing, or supportive services only projects as kind of a counterbalance to the housing retention. One, we want to still value and present in our rating the importance of permanent housing and permanent supportive housing projects to maintain stability for people. And the unsubsidized housing exits is one to balance the HUD requirement and the importance of building self-sufficiency among households in our system with the exits to unsubsidized housing. I know in the room, Jaja had a question.
Unsubsidized housing, is that like private housing?
Unsubsidized housing means it is housing where you are not receiving any financial support
Gotcha.
for this unit. And the unit itself is also not being subsidized in any way. So there's no tax credits connected to it. No project-based housing voucher through a housing authority connected to it. Is a straight up market rate.
Got it.
Yes, Dorsal.
Agree.
Is this like I'm a case manager, move someone from rapid rehousing to unsubsidized housing, and they're successful for the first month, but then month 2 they have to get a subsidy to maintain their housing. Like, how does that interact like with this metric? Is this like just like the key they got when they left my program is an unsubsidized housing, so that's a 1 in this category? Or is there like a range where like they have to be stably housed in unsubsidized housing for 90 days, similar to how like we permanent housing with subsidy and HMIS, like you have to document they've been there at least 90 days, I believe, for the
This metric is going to be looking at, of those who exit this program, how many exit to unsubsidized housing. That's really, the measure for this single metric.
Okay.
So it doesn't matter if they can maintain their.
That is not what is
It's
measured
just
and not
that
what's
they want
evaluated. It's around the exit. The next piece that we will be looking at is around exits with earned income. This is one of the measures that needs its total, along with 2 others, has to be at least 25% of the total points. So this measure is going to be a high scoring measure. It will measure the extent to which adults in the program who exit with employment income. The baseline expectation will be set at 20% of adults in a program exit with employment income. It will also very likely have gradient scoring for ranges to meet to receive points, as it will need to be one of the measures that has a good chunk of points attached to it to meet the overall 25% point allocation threshold. Those are the major criteria that we anticipate seeing differences from what we had in FY '24. Yes, Devin.
Sorry if I missed this, but is the exits with earned income, is that a new metric?
It is
Or
not
how
a
did-
new metric. It will be with earned. No, it is not a new metric.
Okay,
The change will be the amount of points allocated to this particular criteria.
okay, got it. Thank you.
Like in FY '24, the total that this metric could get was 3 points. We will see this receive more than just 3 points in a total. Right now, I have projected to be a 10-point question. Again, the point totals are asterisks. Those will be finalized once we see the NOFO itself.
This is Kristina. I want to follow up with Devin's question. So then when you say it's going up, the metric is going up. In other words, they want to see more people employed. And so we're going to get more points for people employed. Is that how we get more points? Is that what that essentially is saying?
No, so there's two different things that we are looking at for this. One, the baseline expectation is the 20% of people who exit. What's increasing is how many points a program may receive if 20% of their participants who exit with income. So in 2024's competition, the total you could receive if you were meeting this expectation was 3 points. This coming year, if you meet at this expectation, we anticipate you receiving anywhere from probably 5 to 10 points. So that's what will increase, is the total a project can receive in the points that they get and how we rate them locally.
One more follow-up question to that. The screen says earned and you just said income. So that's where earned income to me means employment. Am
Correct.
I
Yes.
thinking, okay, that's where I was getting, because a lot of our neighbors received unearned income or going for unearned income versus earned. Okay, so
yes. We have a measure and will continue to have a measure that also evaluates exits with unearned income.
Okay, that's what I just wanted to check. So then my final question is that what do we have in place to help? Is KCRHA, or are we partnering? And I kind of asked this before, but I kind of didn't feel like I got the answer. How are we going to increase or help support our agencies with increasing both our earned and our unearned income for their clients? What's going on with that?
Yes, so that is part of the kind of secondary objective of the request for information around evaluating what are partnerships that currently exist around income and employment to have a more in-depth awareness of what's going on. And there are other things outside of the NOFO, such as the convenings or other trainings to do to provide and amplify potential partnerships with folks to increase access to earned and non-earned income.
And I'm sorry, my final question, is this something we could possibly use as a training for our next COC convening on earned and unearned income? Because it's coming pretty quick and it's pretty important. And I hear that from the service providers that they're trying to find housing
earned and unearned income kind of gets stuffed to the bottom. And so this, I feel, could possibly help our agencies, our orgs with this difficult task.
That is what the convening work group is working on for July. So yes, that is underway. I also would want to highlight the great work that the Seattle King County Coalition on Homelessness does. They do trainings regularly, and we help promote and use a lot of what they're doing around provider training work, particularly around access to SSI, SSDI, TANF, and SNAP benefits. So they regularly do those as well, and would really uplift a lot of the work that they do as a partner in our COC.
Just really quickly, and I might be getting metrics confused, because the way I thought I'd heard this expressed before was change in income. And the intent was someone enters my program, and at the end of the exit from my program, the intent is for them to have increased their income. The way this is written, are we saying, so like if somebody enters my program with a job and they leave my program with the same job, like that is an adult in the program who's exiting with employment income. So like, is that really all we're trying to establish here? Or are we trying to look at actually like changes in increasing employment income to create the likelihood of housing stability?
So I want to be clear that this is different than our system performance measures and what we want to see in our system and how we evaluate our system. This is strictly how we are rating projects for NOFO rating criteria, using a lot of guidance around what HUD is evaluating and looking at, and their measures. So it's really following the exit. What is happening at the exit around income? Is it earned income, non-earned income,
Right.
no financial resources? Those are the evaluation measures.
Cut and dry.
Yeah, and I would also say, and I'm gonna put on my Claire hat and say, the more complicated you want to look, that's really complex coding. And it can be very hard to accurately and measure that in a way that is like really clearly measurable. So wanting to make sure that it is clear and concise, because we can have, all the things we want to evaluate and determine, but when you're looking hard and fast at data, you then have to be able to evaluate that. And you can't always get that nuance in that coding. So this is why this is a cut and dry measure. And that's, yeah.
Could you share who Claire is?
Claire is our data analytics manager who is writing this code. So that, yeah.
I guess though, I hear what I think I hear what you're saying, Kelsey, but also isn't the actual expectation on the provider the same? In order to document this, the provider will have to have a pay stub at the entry point and a pay stub at the exit point, which in HMIS, you could input those two to get the change in income. I hear, like, it's just like the document.
That's a different measure.
Okay.
So yeah, so those are two separate measures, two separate things. For the NOFO rating, these are the measures we're using, mirroring what we see in system performance measures and annual performance reports.
One is binary,
Yes.
yes or no?
Pardon me. Other questions before we move into the next kind of chunk of things? And again, just presenting in this space, the main change pieces, you all have the full details. And we went over the full details in the System Performance Committee meeting. So I'd encourage, if you have not reviewed those pieces, to do so, particularly ahead of June 3rd. All right, so I'm gonna move us over to the non-HMIS data-based or fact-based criteria. These are rating that does not happen using HMIS data. Rather, it will use data from other sources, but it's based on facts about a project. The first is project expenditures. The change that we are making here is around gradient scoring and including more steps between the highest number of points and no points. So the highest number of points will be given to those projects whose underspend of their budget is less than 5%. The next range will be their underspend is 6 to 10% of their allocated award. The next step is 11 to 20, and overspend over 20% of an award would not receive any points. Previously, this was an all or nothing score, I want to say. I'm looking at Tom just to look at Tom. That's something my mother does when she's thinking and she looks at you and like, I don't have the answer to what you're thinking. But thank you for looking at me.
So the 6 to 10% was overspend or underspend?
Underspend. You cannot overspend a COC grant. The federal government will not allow that.
But the last one I thought you said was 20% overspend.
Under.
Oh, under.
All under.
Okay, I was confusing.
Understand over 20%.
The next measure is going to be a new criteria that we are allotting points to. This was reviewed in the local application for just information, but did not have a score attached to it. But this is around timely submission of the annual performance report. This aligns with our rating, or the project rating that we get from HUD when HUD evaluates a project around, did you get your reports in on time? So we are going to give points of, did we get reports in on time? So wanting to just make sure that we are being very explicit that this is valued in terms of efficiency of grant management. In that same line, we are also creating points that will be allocated for monitoring results. The review of a project from the HUD view of, does this project meet our thresholds? Do they have open findings or not? So we are going to be instituting that both if they have HUD level or in KCRHA monitoring, if they have open findings or recommendations for their project. So again, wanting to align with the HUD priority of merit-based scoring and ensuring that we are including this metric in how we evaluate and rank our COC projects. The final fact-based metric is a big asterisk, but this is around support services participation. This recommendation to include may change pending the FY26 NOFO publication. In the FY25 NOFO from December 19th, there is a requirement that projects require engagement in supportive services such as case management for all projects. The crystal ball is not super clear on whether or not this will be included in whatever is published in FY26. It is currently in the kind of guidebook NOFO we are using one of the criteria that must be included for the 25% threshold allocation. So there's 3 measures that 25% of your over total need to include those 3 measures. The supportive services participation is one of those 3 measures. This will be reviewed once the NOFO is published, if this will be there or not. It is a little uncertain around whether this will still be a requirement in FY26. We talked about this not too long ago, the other timeline. This one I didn't actually update based on, I forgot that I had this in 2 places. I'm gonna go back. Hold on, close your eyes. Here we go. This is the more accurate timeline. We will take your thoughts and considerations and questions to look at how we may, make changes to points and allocations and metric details. Again, May 20th, the System Performance Committee, that will be focused on new project rating. What we talked about today is for renewing an existing COC projects. It will not relate to a new project because that new project probably won't have all that data and information for us to be evaluating. So if you are not on that committee and you are able to tune in on May 20th, please do. If not, the recording and all materials will be provided to you all ahead of June 3rd and June 8th. June 8th, again, is where we hope to have a joint special meeting of both the SPC and the board to do a final, very in-depth. We are going to talk about every measure, every rating. You are going to get bored and tired of hearing from me. And hopefully by the end of it, be able to move forward on some updating rating criteria. I may come in wearing bells and whistles just to keep it a little lively. But so more to come, but really wanting to pay some close attention on this. Also just want to end with a note of updating our rating criteria, particularly our HMIS criteria, has been a goal since 2022. And kind of thankfully, because of the roller coaster of FY25, it allowed us a little bit of a mirror to look into to what we may see, and has kind of allowed us a little bit of the time and capacity to give this thought and attention. I know on behalf of myself and Claire, who's not here right now, this has been a goal for a long time. And it is really wonderful to be able to finally dig into this in detail and achieve updating this rating criteria.
Could you please, could you respond to the doodle poll if you have not responded yet for the June 8th meeting? Please and thank you.
And other questions?
John Urquhart here. So let me paraphrase what I think I'm hearing here today. So you've got all these people that are getting money now. They have to be reviewed or they get more money. So we're coming up with a rating system, an objective rating system with a certain number of points. And if they don't meet the point threshold, they don't get no more money.
If they don't meet the point threshold, they would be rated lower on our priority.
Right.
They may still receive funding. The risk of not meeting their point thresholds is falling into what is likely to be called tier 2. Tier 2 are those projects that HUD is saying, you don't meet snuff, we're putting you in a national competition. If your COC as a whole is performing well, we might renew your project. If your COC is not performing well compared to other COCs in the country, this project risks getting funded.
So no explanation is simple.
Correct. In the NOFO, nothing is simple.
That's good. I get it, sort of.
Yes,
Remember, I'm new.
right? It's, the NOFO is its own special beast.
That's encouraging.
Other questions?
And being mindful of time, we probably have time for one more if somebody has it. You can always put questions in the Q&A as well. All right.
Well, I will say, thank you very much. Elizabeth handed me a whistle. Thank you. All right, I will stop sharing that.
All right. I apologize I didn't mention this sooner, but if you were not aware, this COC board meeting is planned to go into overtime. So I can't get too much COC. But wanting to get out of here as quickly as possible still, we will go ahead and wrap up with our final agenda item on the coordinated entry pilot assessment. We'll be hearing from the wonderful Tom Reagan.
Thanks, Dorsal. Hi, everyone. My name is Tom Regan. I use he, him pronouns. I'm the coordinated entry system manager here at KCRHA. Forgive my voice. I'm overcoming a cold, so sorry that I sound a little scruffy, but I'm going to do my best. And also going to do my best to try and wrap this up quickly so that we're not staying on too long. Thanks, Kelsey, for showing the slides. Okay, so like I said, my name's Tom. What I'm here to talk to you all about today is an update and hopefully a little bit more of a description of what a focus group with the Coordinated Entry Committee has been working on over the last year to develop a new assessment for prioritization for this for our community. Here's a brief agenda of what I'm going to talk to you all about today. I'm going to frame the issue and the challenge with a little background information. And then kind of get into a little bit more about what the problem is and what we're seeking to solve for and some of our objectives. I'll talk to you about the methods we've used to develop a new assessment that we would like to pilot. And then I'll talk to you a little bit about the results of where we are. The work is not yet complete, but I'm going to give you a timeline and kind of a summary of what we've developed so far. Then we'll talk a little bit about the next steps that will be involved. Some extra information about some future opportunities here. I think this is a topic that's that can be really complex. It's a very rich topic. It's also one that can be really exciting to talk about how we can more work closely and more collaboratively with our partners and other adjacent systems. And so there's some exciting things there too. So a little bit of background. This community has not used the VI-SPDAT assessment for prioritization since October 2020. I have that as the first point, and I have the particular words around that bolded and highlighted because this is really important to know. And I cry a little bit inside when I hear people in the adjacent community talking about coordinated entry and sometimes openly postulating or wondering if we still use the VI-SPDAT in this community. We don't, and we have not for five and a half years, almost 6 years. So it's been a long time. We were one of the earliest communities in the United States to identify that the VI-SPDAT uses overly invasive questions that were not particularly reliable at determining the level of information to really accurately align high needs individuals with the most abundant resource we have in our coordinated entry system, which is permanent supportive housing. And the way that the workforce that was administering this assessment broadly reflected mostly white people, and in doing so, perpetuated racial inequity. And so we were actually one of the earliest communities in the United States to say, we would like to not use this assessment anymore and would like to try something different. The something different that we were able to get to was actually something that was really innovative and trailblazing for the United States. And to my knowledge, is something that no other COC in the United States has really adapted or used in the same way that we did. So between 2020 and 2023, due to the emergency status of the COVID-19 pandemic, a lot of red tape was able to be slashed through, and we were able to achieve really great and useful data use agreements with our partners at Seattle King County Public Health and the Washington Medicaid. And so what that meant was that we were able to collect data in HMIS about risk factors for folks who are the most likely to die from the COVID-19 pandemic. Things like the factors that we knew made it more likely that people were going to, suffer mortality or morbidity from COVID-19, like their age, their race, their different demographics, pregnancy status, and use those types of factors to prioritize people and really answer this question of who's most at risk of dying on the streets from COVID tomorrow. We would like to prioritize those households for housing. And that's what we did. But when the pandemic ended, so too did those data use agreements. And so we knew in this community that we had heard the feedback loud and clear. We don't want to go back to using the VI SPDAT, so we didn't. But we did not have another assessment that we could use. And so we adopted, as you see there at the bottom, those bottom three bullet points, 1, 2, 3, we adapted those kind of different factors for prioritization as an interim way of prioritizing households for housing in coordinated entry. It was only ever meant to be interim, but it has instead kind of persisted over the last several years, since we don't actually have an assessment that can replace. So we can go to the next slide here. And those risk factors are, it's the length of time that someone's been experiencing homelessness, and that's by self-report. The next one is whether a household is attempting to flee domestic or intimate partner violence. And the third being whether or not the household is sheltered or unsheltered. It's very important to note that those go in a cascading order. So if coordinated entry is able to match someone to a resource just off that first data point of how long their length of time homeless is, we're not looking at the other two. Oftentimes we hear a lot about people being confused of, we hear that you prioritize people who are unsheltered rather than those who are sheltered. Why are you not prioritizing sheltered households? They're also homeless. We want to make sure that we're emptying shelter beds so we can get unsheltered folks into those beds. That is a fallacy. That's not happening. Most times we are just prioritizing people based off of that first data point. How long has the household been homeless for? It's very important to understand that. So the problem with this is that this current system lacks an assessment that actually that prioritizes people. So we're not using a fulsome assessment that's looking at people's needs and vulnerability risk factors to determine who should be prioritized. In our community, HUD requires a crisis and housing assessment, and we have one. It's called our housing triage tool. This assessment uses the bare minimum requirements that HUD asks for in order to, meet their standards for doing coordinated entry. And this collects data points like pregnancy status, prior living situation, household size and composition, and age, those types of things. Those are kind of like the mandatory minimum data points that HUD wants us to collect in order for it to be considered an assessment. But it doesn't ask more than that. What we have outside of that is what's called our housing needs form. And that's collecting people's self-reported, housing needs and desires and preferences for what it would take for them to be successful in housing. It's not an assessment. This was a needs form that was designed to try and help kind of match folks in a potential kind of future state when maybe we're matching people to resources based off of a by name list. But it's important to understand that this housing needs form is not a fulsome assessment. So last year, I was talking with our coordinated entry committee about this, and they said to me, well, Tom, we as your kind of board of committee members say that your system should have an assessment, and that's kind of where this work started. Another way that's really important to look at this problem and to think about why we're solving for this issue is that these are numbers for how many referrals coordinated entry facilitated in 2024 and 2025. And then you have a split of how many of those people actually enrolled in the project to where they were referred and how many people were denied from the project. These numbers are better than they have been in the past. I think in 2022, the number of referrals that were denied through coordinated entry was closer to 50%. Gotten that down a little bit to that 2-year average would be 44.5%. That's good. Personally, I would really love to see that number be better. I would really love to see closer to 100% of the referrals that we send through coordinated entry actually enroll into the housing programs that that they're referred to. But as you can see here, we have some work to do. And you can go to the next slide, Kelsey. This is a little bit more of a breakdown of the total denials. So this isn't of all the referrals, this is just of the denials. And I have the reasons highlighted in red, the number of times and for what reason actually comprise these referral denials. And what you can see is that for both 2024 and 2025, the largest reason was because the household refused the resource to where they were referred. 2 other major reasons are that they were ineligible upon their referral or the property manager denied them. Data quality is something that, you know, still needs to kind of really be perfected when it comes to tracking these referrals. I would say that from my experience, when we're talking about property manager denials and ineligible, some of those, I wouldn't be surprised if there was some significant overlap, that the property manager was denying the household because they are ineligible. And sometimes you have one agency who likes to click that reason, and you might have other agencies who click ineligible upon referral. For the property manager denials, this also could be things like the person has significant property damage at other permanent supportive housing projects in their history. Now, the new property manager is saying, you know, we're actually not going to accept the household at this time, you know, things like that. The main takeaway I have for you all with this is that 54% of all of the denials in 2024 and 2025 were either due to a client refusal or what I would say these ineligibility reasons, something about a service misalignment. So you can go to the next slide.
Dorsal has his hand raised. Do you want to do your presentation and then questions?
Yeah, Dorsal, I'm gonna have Q&A at the end. We'll have time for that for sure, so. But so, you know, sorry, that made me lose my train of thought, I apologize.
Yeah.
The service misalignment and, yeah, and so really, what I would say to you all is a huge factor in driving down the number of those denials is that if we're able to adequately and accurately assess people's needs with a true assessment that can actually assess people's vulnerability risk factors at the front door of entering the coordinated entry system, then we're going to do a lot better of a job at matching folks and prioritizing folks for the resources that we have and more thoughtfully, and in doing so, hopefully drive down the number of these referral denials and kind of reduce some waste and reduce some inefficiency in our system. So our objective is to utilize an assessment for prioritization and coordinated entry. The other objective we had is to develop this through a focus group of members of our coordinated entry committee. And then we want to pilot this assessment for its reliability and validity. We want to see if what we develop is both reliable and valid. The goals we had for this project were to maintain and always keep an eye on equity in the coordinated entry system, prioritize the most vulnerable people for the resources we have in our community. We have a lot, we're unique in this continuum of care. We have a lot of units of permanent supportive housing, more than a lot of other communities in the United States have. It's a big privilege of ours that we have so many of these units. And we want to make sure that the people in our community who are the highest needs individuals are actually getting matched to those units, right? The other thing too is that, while I just showed you, 44.5% of their referrals we send result in a denial over the last couple of years. That is an improvement over years before. And another thing too is that our system has been relatively efficient. When our team does send a referral to housing, people are moving in at a more rapid rate than they also had been in the past. And provider feedback and our own data suggests that the units that we have available don't stay vacant for an overly long period of time. And so that's something that our providers have given us as a positive piece of feedback and something that we've been proud of. We want to make sure that we maintain that process, the efficiency of that process. So how did we build this assessment? Well, the first thing we did was we started with the landscape analysis. We researched all the communities in the United States that don't use a VI-SPDAT to assess and prioritize in their continuum of care. And we reached out to those communities, we asked them for copies of their assessments, and we looked at them and we read them and we went through them and we looked at the questions. And we reviewed them against a list of priorities for the domains that we thought were important for our community. We held focus group sessions with members of the Coordinated Entry Committee. We have representation from family, single adult, and youth subpopulations. And many of the members of our focus group were also people who are on the CEC. And yes, they are providers, but they're also people with lived experience in homelessness. So that was something that was really important to us to ensure that, incorporating lived experience in the development of this process wasn't just a check that we were adding to the end of something that was already developed, but it was something that was baked into the actual development of the tool itself. The first step, when we wanted to identify the vulnerability risk factors and really get down to the nitty-gritty of what questions do you want to ask in this tool and how do you want to do this, was we identified the risk factors that were important to this community. Then we organized those risk factors by severity. Once we organized by severity, we organized them by their difficulty to assess. How easy is it to ask someone about whether or not they have pets? Or how easy is it to ask someone about their chronic homelessness history? Those are two really different things.
Right.
After that, once we kind of had that as like a matrix, we selected the different factors that we knew needed to be in the assessment. And then we started to workshop questions. So here's a kind of like a little graph. And so on the y-axis, you see those vulnerability domains at the top are things that are easier to ask about, whereas closer to the bottom, they're harder to ask about. And then when you go out on the x-axis to the right there, those are the factors that are kind of more important. Or another thing, an asterisk with this too, is that everything's important to ask folks about when we're wanting to prioritize people for housing. And that said, we also don't want to overburden people with invasive questions and also make these assessments really, really long. So it does come down to a place where you have to prioritize things and you have to make some cuts to make sure that we don't end up with an assessment that has 45 questions on it that's going to take an hour and a half to do with someone, so but I want to kind of caveat that more important, less important, it's all important. We're being asked to do this hard work of prioritizing this. So after meeting with the focus group and working through these steps, what our community decided that we wanted to do is we wanted to have a phased assessment approach. We started, this kind of conversation with looking at what are the resources that are available to people in coordinated entry in our community. It's largely rapid rehousing and permanent supportive housing. There's some joint component programs for youth, and which joint component are joining transitional and rapid rehousing. There's some transitional housing programs, very few for single adults, some for family. It's really mostly permanent supportive housing and rapid rehousing. And so we thought one assessment to prioritize people for rapid rehousing and permanent supportive housing wouldn't make sense. We've done that in the past. It didn't make sense then. It wouldn't make sense now. They're very different program types, as we all just talked about. Kelsey. So something to initially triage and have people come in the front door and really think of it like the emergency room. What is the issue that's bringing you here today? Is this something that could be served through diversion? And if so, we'll make that connection and make that referral appropriately. But if a household could be served by rapid rehousing, then we ask a series of questions about that and prioritize those households. And then quickly and rapidly determine, is this a household that is probably going to be need to be served by PSH? We'll wrap this assessment up now and actually have them do another assessment so that you're not overly burdening a household that doesn't need to answer questions about PSH. And then also making sure that households that do have to, that, we'll have another time where we'll be able to ask those in-depth questions only to a certain amount of people where it's absolutely necessary to ask those questions. The domains that are going to be included in both phases 1 and 2 of these assessments are some opening triage questions, basic information about, what yes or no, do you have disability, do you have income, etc. And then prior and current living situation, household size and composition, demographic information, a little bit more in depth, health history. This includes behavioral health and substance use, dependency types of questions, eviction history, legal challenges, asking if folks would benefit from culturally specific services. We have some pretty rich and diverse culturally specific services in our community for Native folks, for folks who identify as queer, and for Black and African American households too. I'm probably forgetting some others, but we do have some programs and supports, permanent supportive housing, specifically targeted for certain populations. Immigrants and refugees, that's another one. So asking folks questions about that, and then asking people about their social supports. So the next steps with this assessment is we need to complete the assessment tools themselves. They're still being workshopped by the focus groups. And I would really love to finish drafts of those by the end of this month. Our coordinated entry committee meets on May 28th, and I'd love to bring them a completed draft of tools that would like to pilot and move forward with at the end of the month. Circulate these for feedback throughout the month of June. Develop the evaluation, right, of how we're going to pilot this with kind of like a smaller group. Don't think it would be possible and probably not smart to try and pilot it with the entire King County coordinated entry community. We want to, develop some front doors and some housing programs, both PSH and rapid rehousing, that we're like sending folks to kind of see how effective and efficient this tool is. And then work that through the KCRHA governance structure. We need to work with BitFocus to develop and get this into clarity in HMIS, and then have the coordinated entry committee approve it, and then bring it back to you all to vote on officially this summer. I mentioned some future opportunities here. Really, the biggest thing, this type of goal will be huge for our community. The other thing too that I really have my eye most, like, I have this on, and then really almost co-equally my eye on as a goal for our system is much stronger collaboration with our cross-system partners in the medical, behavioral health, and public health sectors. I have been really kind of like making the rounds to talk to people from those different systems. And my elevator pitch is really kind of like HMIS data alone is insufficient to align high needs individuals with permanent supportive housing. You all in your systems have data of who you know are probably experiencing a housing crisis, and also use your systems a lot. and our high needs individuals who are continuously cycling in and out of jail, continuously cycling in and out of the emergency room and using the emergency room as their primary care provider. The folks who have severe substance use disorders and are frequently using inpatient treatment systems, people who are severely and persistently mentally ill and are regularly, potentially involuntarily committed to short-term holds in our inpatient psychiatric treatment facilities. That's really the community that permanent supportive housing is seeking to serve. And so we need some better alignment on who those systems are seeing as their high needs individuals and are homeless, and who we are seeing in HMIS, because the overlap needs to be stronger. So I've been talking with those, and if we had an assessment that could collect risk factors, we could do something like share our HMIS data with them, and they could just validate and say, yes, KCRHA, the people that you're seeing as collecting is saying like, yes, I have been to the emergency room 6+ times in the last 6 months. I have been ITA'd 3+ times. They're saying, yes, that's true. We also see that in our system. That person is, according to our, medical admin data, someone who should be prioritized. Okay, thanks for your patience. Dorsal, I know your hand is up. We'll start with you.
Yes, I'll go quickly. We got about 2 minutes. I really appreciate what you're saying about the medical piece in particular. But I wanted to ask quickly. So one of the numbers you didn't highlight was that there was an increase in the number of clients who did not move into, or who were not referred, I guess, properly because they were already housed by the time the referral went through. It was actually close to about 100 people difference between the 2 years. And so happy to hear like later if you want to send me an email, like why you think that might be. Is it a speed? Was it a speed thing? Was it similar to a thing where it mismatched? Yeah.
Yeah, thanks, Virgil. It's hard for us to draw conclusions from some of this data because it's like we pull it raw, but we didn't necessarily kind of do so with like doing a testable hypothesis. So the type of question you're asking is a great question that could be applied to the data to say, hey, we saw an increase, why? And then asking that type of question and then seeing like what were the factors going into what was going on over those periods of time. I say all that to say, I don't want to speculate and draw conclusions on why exactly that might have been the case. There could have been a lot of reasons why, in 2024, there were 51 people who self-resolved before their referral was able to be successful. And then the year after 122. I don't necessarily have a actual, tested hypothesis to tell you why that happened. Yeah.
We had at least 2 other questions, but we are at time. For Jaja and Kristen, would it be okay to submit the question in writing after the fact?
Oh, mine was answered. Thank you.
Okay. Thank you so much, Tom. That was a really great presentation. I'm really excited with the work that you all are doing. I'm excited. All right, we are at the end of our meeting. So we will go ahead and we will adjourn now at 4:30 p.m. Please respond to the poll that Catherine sent. I haven't done that either, so I promise I will go do that now. Have a wonderful rest of your Wednesday.
Thank you. You as well.
Thank you.
Thank you.